Welcome to the Institute for Strategic Policy Solutions. My name is Kimberly Jackson, and I'm the executive director of our think tank here at the college. We are located on the Seminole campus, and we're so honored today to engage in this partnership with Leadership St. Petersburg Alumni Association and Unite Pinellas, and with our special highlighted speaker, Dr. Stephanie Reed. This is an important conversation we're having today about COVID. This past year, of course, we have all been impacted in one way or the other by COVID. And we have taken the time to do an analysis across the community to determine how we can best engage and understand what is going on with this particular pandemic and how we can assess and do better as we have to live with it a little bit longer. At this time, I'd like to thank Dr. Sherron Brown. Sorry, we're all on the screen very early this morning for embarking on this three-part series with us. We have two more series ahead with Dr. Coe and Dr. Gurrier later on this month and next month. Before we begin, I'd like to tell you a little bit about the Institute for Strategic Policy Solutions. Again, we are a think tank on the campus where we seek to have nonpartisan conversations about social, political, and economic programs. You can learn more about us at isps.spcollege.edu. And with that, I'm going to turn it over briefly for Dr. Brown to say a few words on behalf of the Leadership St. Petersburg Alumni Association. Dr. Brown.
Thank you. Good morning. Thanks for having us. Thanks for partnering with us, and good morning to everyone. I am Dr. Sherron Brown, Executive Director of the Tampa Bay Healthcare Collaborative and a proud member of the Leadership St. Pete Alumni Association Board, where we are comprised of graduates of Leadership St. Pete. As far as LSPAA is concerned, the Alumni Association, we like to think of ourselves as an extension of the original program, Leadership St. Pete, where we continue to encourage voluntary activities in the community, initiate collective discussions such as the one today, and support continued development and expansion of our members. And so we're glad to be able to partner this morning to bring you this very important topic so that as a community, we can continue to address this and co-create our solutions together. So thank you for being here this morning. And thank you, Kimberly, for allowing LSPAA to partner with you on this very important issue.
Thank you so much. Of course, it's a pleasure. As I always say, I think every class says this, but I think we are the best class of 2004. So that's an ongoing running joke with members who graduate. So with that, we're going to start our program. I'd like to introduce our first speaker, the lead speaker for today, and that's Dr. Stephanie Reed. And we've had the pleasure over the past couple of weeks to sort of embark and discuss this. And you know, COVID, again, brings out so many different challenges in how we talk about it. And we thought having someone with the experience to talk about what the data reveals is important. Dr. Stephanie Reed is an experienced research administrator and teacher. She currently works as senior research consultant with the Foundation for a Healthy St. Pete. She is passionate about eliminating health and racial inequities and has developed and taught courses in health disparities. Her research interests include disparities in preterm birth, infant mortality, and the health and race equity. She received a PhD in maternal and child health from the University of North Carolina at Chapel Hill, a Master of Public Health and Epidemiology from Florida A&M University, and a Bachelor of Science in Biology from Florida State University. Incredible background. Thank you for joining us. Our next slide, please. And Tim, I want to again thank you for embarking with this because we've had several conversations for a while about how we were going to discuss this. And Tim Dutton is the director of Unite Pinellas Collective, which is committed to generating policy, practice, and narrative change to increase racial equity. Unite Pinellas developed an equity profile with PolicyLink, guided a team to identify state-level policy changes related to fees, fines, and evictions, and engage people with lived experience to contribute to improved policy solutions. Unite Pinellas convenes sector leaders to improve the diversity, equity, inclusion in nonprofits and philanthropies. And we're going to get started. We're going to have a presentation from Dr. Reed. After that, followed by some commentary from Mr. Dutton, and then we're going to engage in conversations. Thank you all so much for joining us. Dr. Reed, if you'll share your screen and begin.
Good morning, and thank you so much, Kimberly, for having me today. I've been invited to speak, and I'm appreciative of the opportunity to speak about population health amid our COVID pandemic that's happening right now. As Kimberly mentioned, I'm joined today by Tim Dutton from Unite Pinellas, and I'm going to allow Tim a moment to share about Unite Pinellas before I dig in.
Thanks, Stephanie. I really appreciate that. To be clear, Unite Pinellas, as Kimberly indicated, focuses on race equity in Pinellas County. We do that through a data-driven approach that manifested itself in the equity profile about a year and a half ago. Fundamentally, this organization focuses on solutions. And those solutions really engage people with lived experience so that the solutions have practical value. We're going to talk a little bit more about this at the end, but COVID has brought up some serious issues that relate to topics around evictions and how they manifest. They manifest seriously normally, but the COVID-related issues brings that to a head. I also want to spend just a minute saying that this discussion today is really around the data that relates to COVID and how it's played out in a race equity way. And it's local. The other thing I want to let you know is there's nobody better than Dr. Reed to be presenting this information. And Kimberly already described her as passionate, and that certainly is true. I look forward to talking to you at the end of the conversation, talking with you about the kinds of solutions that Unite Pinellas is working on and others that can come out of this kind of community dialogue. Stephanie?
Thank you so much, Tim. I appreciate that. So I want to dig in by first talking about what population health is. And, you know, my background is in public health. Those are my degree areas. But population health is akin to public health, but slightly different. When we think about population health, we think about it being an interdisciplinary approach that brings different sectors together to create outcomes or to create programs and policy and generate momentum to achieve population health outcomes. So when we think about public health, though, we're talking about things that we're doing to prevent. So there's sectors of public health, that's epidemiology, that's doing the research and the data analysis. And then we're all working to try to prevent disease and health. And public health is a part of population health. But as we dig in today, we're looking at COVID and how it has been propelled by all of these other sectors, not necessarily seeing a doctor. When we think about health, and sometimes we're thinking about, well, how did COVID come to impact people? Was it because they didn't see a doctor? But COVID was so different that it's not about not seeing a doctor, but it's these other sectors and disparities in these other sectors that affect population health that resulted in a lot of the issues we see today with COVID. So if you've been following the data around COVID, you know that we had deep racial disparities with COVID. We had higher rates of COVID-19 cases among all people of color: Hispanic, Black, Latino, Asian, American Indian. And this was not just local, this was nationwide. But I'll be sharing some data that are specific to our local area, to Pinellas County, to highlight some of the disparities we've seen with COVID cases. We also saw immense and deep economic disparities. So there was deep job loss. There was deep impact in the service sector and the hospitality sector, specifically around these sectors having to close for periods of time. And there hasn't been quite the same recovery in some industries, including service and hospitality sectors, as there have been in other sectors. And I'll share some of those data as well. But I think the main thing I like to highlight is that these disparities are tightly intertwined. It didn't just hit Black people, Hispanic people, without there being this economic issue that led to the disparities by race. About a year ago now, I guess starting in April, we started tracking these COVID cases by race. We use data that were available from the Department of Health at the state level. But we took these data and we disaggregated them by race to calculate rates of COVID by race. So you see here we have rates of COVID over time for Blacks, Hispanic. The other is including Asian Americans, Hawaiian Islanders, Native Hawaiians, Hawaiian Pacific Islanders, American Indian. All of those population groups are combined to represent the other group, and then whites as well. And each of these rates are standardized to the size of the population for each of those racial groups within Pinellas County. You can see over time, the blue line, which represents the Black case rate, was the highest for a long period of time, over all the way through November. And then at November, it was overtaken by the group that's considered other, the Asian and those other populations I mentioned. And through today, we have the highest case rate being a population of color, and then Black is the second highest. At its height, the disparity between Blacks and whites was 3 times. The Black case rate was 3 times as high as it was for whites. And we see even today, the Black case rate is about 1.5 times the rate of whites. And the case rate for others is about twice the rate of whites, the rate of whites. Here I'm sharing death rates, and we see again in blue is the Black death rate for COVID. The line blue was highest for a long period of time, and then it was overtaken by whites. And so today, as of March 3rd, which was yesterday, we see, or 2 days ago, the rate ratios for Blacks to whites was below 1, which means in statistical terms that the rate for Blacks is lower than the rate for whites, as well as for Hispanics and for other. However, I caution you in interpreting these data to say that the death rates are definitely that way, because we have so many people who have been diagnosed with COVID or who have died from COVID that we do not have a race represented for. So I don't show those data here, but there's a significant population of people that have unknown race in the state data. So we don't know the true disparity, because we aren't able to calculate or to categorize those people for whom we do not have their race recorded. So since we're now in the phase of vaccination, I want to just share some data around vaccination rates and percentages of populations that have been vaccinated for COVID in Pinellas County. And the green line is Asian Pacific Islander. So as of Wednesday, 14% of Asian Pacific Islanders have completed the series. They've been fully vaccinated against COVID-19. That's compared to about 7% of whites and about 4% of American Indians, Alaska Native. I'm so happy to see that the Department of Health is now breaking out some of these other racial and ethnic groups. In the beginning, when they were tracking data for COVID, it was all collapsed into that other group that I mentioned, but now we can clearly see how Asian and Pacific Islanders have been broken out and American Indian, Alaska Native have been broken out. For Latinx and for Black communities, we see that both of their proportions of populations who've been vaccinated is less than 4%. So there's some work to do there. When we look by age groups, this is definitely to be expected because certain age groups are prioritized right now for vaccination. But our highest groups are the 65 plus. So the purple line is 65 to 74-year-olds. The next line is 75 to 84-year-olds, and below that is 85 and above. So we're seeing those numbers of people getting vaccinated go up. And if we look at the 65 and over population alone, we can see the proportion of the population who have received at least 1 dose of COVID. So they've received 1 or 2 doses. That's 47% as of Wednesday. So that's very good since that's the priority population. So we're almost halfway done with vaccinating the population that is 65 and over in Pinellas County. And then we can also see around 23% each have either been fully vaccinated or have received 1 dose. But again, that 47% is those who are on the path to be fully vaccinated and have been fully vaccinated. So I also like to share some of the impacts that have happened economically in Pinellas County. And here, if you look, if you see this, if you read that top line in the chart more closely, it says Tampa, but this is data that represent the Tampa metropolitan statistical area. So Pinellas County is included in that MSA. So over time from January of 2020, these data are charting the impact to the small businesses in our MSA, in our statistical area. The top blue line represents those businesses that are professional and business services. The red line is retail and transportation, and the light green line at the bottom is leisure and hospitality. And as I mentioned earlier, leisure and hospitality have been severely impacted by the COVID pandemic, and we see that there has been a 54% loss of small businesses that are open, and this is data as of February the 22nd. So there's significant loss in all of these industries. However, leisure and hospitality is down by 54%. So akin to that, if we think about employment, these data are as of December 12th. We show high wages, those people that are making 60,000 or above, and this is Pinellas County specifically. Those jobs have actually, or the percent employed has actually increased since pre-pandemic, since January of 2020, by 13.2%. So there was a dip. It fell by almost 10% back in March to April. And then today we're at a 13.2% increase over January of last year. And if we look at the middle wages, those making $27,000 to $60,000 per year, it fell about 20% back in April, March and April. And today we're back almost to where we started in January of 2020. So those wages have almost recovered. However, those in low wage jobs are still at a deficit. So at its height, it dipped down to about 35%, and we still have about 10.7% loss in those in low wage jobs. So there have been a lot of data collected around COVID. The Bureau of Labor Statistics has collected data and have done analysis, done several surveys around the effects of COVID in the labor force. And if we look at by industry, 58% of workers in finance and insurance, and 57% of those in professional and technical services teleworked in July because of the pandemic. In contrast, 7% of those working in accommodation and food services and 6% in agriculture telework. So this is a very specific example of how the pandemic has disproportionately affected people based on industry that they're working in. If your office had to close because we needed to socially distance, if you were in a position where you were able to telework, then you were more likely to retain that position, and that bears out in these data. If you were in a position where you could not telework, the industry didn't provide for it, or you weren't in a position that would allow for telework, then you were less likely to be able to keep that position. There are other impacts, and we don't want to think that just because COVID hit that these disparities just all of a sudden happened, but these were disparities that were in place far before COVID happened. And what COVID did was it highlighted these disparities that were already in existence. So if we think about those who were most deeply impacted by the COVID pandemic in terms of job loss, we can think about where they were prior to the pandemic. So we think about where were Blacks? What jobs did Blacks hold in Pinellas County? And this chart shows the distribution of people working in different job sectors. And this light blue line at the bottom is representative of Black individuals. So we have about 30% of jobs in Pinellas County that are healthcare support jobs in this very first bar are occupied by Black individuals. Conversely, all the way at the end, we have legal occupations, and around 5% of legal occupations are occupied by Black individuals. if we look back at this left side, we see jobs that are more in those service sectors, the healthcare support, transportation and material, building and grounds cleaning, office and administrative support. These have greater populations of Blacks compared to the jobs at the right end of the bar chart, where we have more legal occupations, architecture, engineering occupations. So by virtue of position of people of color prior to the pandemic, they were more susceptible when the effects of the pandemic were here and were impacting the community locally. Alrighty, I can't advance my slide. Okay, there we go. So why did this happen? Why are industry and race so correlated? Well, if we think about historically, the basic reason historically or contemporarily is racism, but there are historical impacts and historical mechanisms and contemporary mechanisms by which racism act in our community and around this nation that make a lot of these disparities so intractable. So specifically policies around housing, policies within criminal justice, um, policies that may have been written that end up having unintended consequences, and policies that were written specifically to negatively impact people of color. There's also biases that can be implicit or explicit. So how we interact with each other and but even beyond that, because there are different levels of racism, even beyond the interpersonal biases that we have, it's how those biases play out in developing policies, for example, or if you go further into hiring, promotion, how we determine who we hire and for what positions that people are hired in, and to how people are promoted through different positions. So I would like to turn it back over to Kimberly, and then we'll have Tim Dutton share some things as well.
Thank you so much, Stephanie. Dr. Reed, I was busy trying to calculate the data as you were talking. It's a lot to absorb. And so I'd like to tell our audience that, of course, this is recorded, it will be posted later, and we can provide as much information as you need after our program today. And I also want to thank you for doing the correlation, which I hope to explore a little bit later, to give context to why we have these numbers and what they really mean in layman's term for those of us who may not have your depth of education. So thank you. Tim, if you'd like to elaborate and expand on your presentation before we get into questions. And also I would like to invite the audience to put your questions into the Q&A so that we can start engaging. And thank you so much, Tim.
Yes, thank you, Kimberly. And I want to also point out that I want to thank the Institute for Strategic Policy Solutions and you, Kimberly, for inviting us to be a part of this. Stephanie mentioned some specific experiences that have happened over the last months. I want to just take seriously just a minute or two to point out that there are solutions. So there are approaches that one can take in community and in the state and in the country to start approaching these issues. Nationally, the data shows that there are something in the neighborhood of 15 million families that are at risk of eviction because of COVID. Over the past year, we've been working to try to change state law so that the impact of evictions is lessened. Frankly, these changes are relevant even before COVID, but they become exacerbated by the pressures that COVID's placed on incomes of families and their vulnerability to eviction. So I point that out just to say that the kinds of changes that are necessary to impact the pressures, the issues that relate to bias and so forth, need to be approached, at least the approach that Unite Pinellas takes is around systems change. Unite Pinellas focuses on data and lived experience as a way of identifying good solutions. But the approach of creating policy change, and by the way, Unite is the policy arm for the Foundation for Healthy Sound St. Pete, is one that has lasting impact. So there are 3 areas that there's 2 areas we're working on right now in terms of state law change. One is evictions, and the other one is, as Stephanie mentioned, the criminal legal system has to do with the fees and fines. We're also working in that area in terms of structural issues that disproportionately impact families and communities of color. So I don't know, Kimberly, I think we're going to switch to questions now, and I have one, if I can start that process, if that's okay. I'd like to ask.
Absolutely. I love co-moderators.
Okay, I'm
I've done that
sorry.
for the past couple of programs now, so that's great. Sure, jump in.
Well, I want to ask Stephanie, if, Stephanie, you talked about the difference in vaccination uptake in terms of what we've experienced so far. And I wondered if you could comment on the historic rationale for how and why that might be explained in terms of how the vaccination uptake, especially in the Black community, is about half of what it is in the white community.
Yeah, so thank you for that question, Tim. I think it's a huge issue that we shouldn't just quickly overlook and just dismiss outright in terms of the percentage and proportions of Blacks who have taken the vaccine. There's a deep history of what's happened with Blacks and other people of color, frankly, with the healthcare system. And I don't think that's something that should be dismissed or overlooked. There's issues of trust because of historical issues. I'm sure people are familiar with the federal government study at Tuskegee, the syphilis study. There's also issues of forced sterilization in the Latinx community and among Black women historically. There's levels of mistrust. There's levels of differential application and treatment, frankly, for people of color. So when you have this deep history of mistrust between people of color and the medical community, it's natural that's going to boil over into other areas like this vaccine. So I think it's very important that we acknowledge and actually respond to and to this level of distrust so that we can ensure that people take this vaccine. The vaccine is a safe vaccine by all indications of the studies that have been done in the clinical trials. And so I think at this point, we just have to be responsible to acknowledge the history, have conversations, and encourage people to take the vaccine.
Thank you for that question. That was actually a great question to kick it off. One thing that we share, although we have different thrusts, is policy. And policy is important to how we impact community. But in order to do that, you do have to have information that's educational and factual so that people understand the gravity of what policy can do and how it can make a great impact. You had some strong data numbers on hospitality and the loss of small businesses. And you also talked about, conversely, about telework. And I'd like to know if you have any comments, or does your research expand on how that's going to impact in the future our economy, not just for people of color, but in terms of those who engage in the hospitality industry that impact our county-wide with the 5 pockets of poverty we have across the county. I often say when people are asking me, if you are privileged enough to work from home and you have the space to work from home, because just because people are working from home does not mean that they are not impacted by COVID. They may not have technological accessibility in the home. They may be taking care of another person in the home who is sick or who is aged or who has an invisible or other type of disability. They may not have the appropriate resources. Maybe they were getting resources at the facility that they worked at or the organization with food or other perks that come with going to jobs and getting employment. So I want to know about how that is, in terms of I guess the word is inappropriate data that suggests that people are doing better just because they're home.
Right. So when we think about the population that are severely impacted, these are people that were always at risk of being impacted. They were, a lot of times one paycheck away from being homeless already, because they're living paycheck to paycheck in some cases. But that's a factor of opportunity, and that opportunity is just not about getting that job at that point in time, but it's opportunity that's been set over one's life course. So there are other data that show that these disparities are intractable starting from birth. So as I mentioned, I studied preterm birth and infant mortality. There are disparities in preterm birth and infant mortality, and those are a factor of the mother's health herself that then make her infant more susceptible to these disparities and outcomes. So if we see that these disparities exist over the life course, based on, think about from where people live, the opportunities in education that they have, and then those opportunities in education impact their opportunities for employment. Opportunities for employment impact opportunities for income and for wealth generation. If there are these multiple impacts that constantly put people at greater risk for poorer health outcomes or for lower health outcomes in general, whether, no matter what area of social determinants of health they're impacting, that's housing, education, income, wealth, then they're going to be more susceptible to any impact that comes along, whether it's a pandemic like COVID, whether it's a major medical emergency that they end up having happen in their life or to one of their family members. They're on the cusp. And then you compound that with not having a living wage. If they're making a minimum wage, it's not a living wage. And then they are more susceptible if there is an impact that comes along. So these are outcomes that are longstanding, and it's going to take policy change to make a real impact and change across the spectrum of impacts over one's life course to have changes in these outcomes.
Tim, do you want to follow up with that?
Yeah, I want to double down on the cause for these differentials in opportunity, and they really track back to historic policies, as Stephanie indicated, and some of them are very explicit in terms of how they played out. And this goes back right now in Pinellas County, the home ownership rate for people who are Black, families who are Black, is 1/2 the home ownership rate for families that are white. And this can be tracked back to a series of laws that started in 1934 that where the federal government really created a set of policies that generated what's known as redlining, and that made it so that the housing opportunities, which is the term we've used now several times, were limited for people who were Black. But it also played out. That, by the way, was the rule of law in this country through 1968. When that's 30 plus years, whenever the housing acts were civil rights acts were taken up around housing. But it wasn't just that, it was a whole bunch of other ones, including Social Security and Fair Wage Standards Act, and even the GI Bill had this disproportional impact on generating different opportunities. The last thing I'll say on this is that education is a big equalizer in many ways. And the data around education shows that if you have more education, you make more. But the difference between somebody who is white and somebody who is Black or Latinx never goes away. So in other words, if you have a high school degree and you're Black, you make less than somebody who has a high school degree who's white. If you have a bachelor's degree or a master's degree, the difference always persists. So it really is an indicator of, yes, you're going to make more money if you get more education, but the difference is always true, and that's the residue of racism and bias.
And tying that back to policy, it's how we access the system for healthcare. So how we access the system often depends, of course, on our network, our access, our ability, and our resources. You mentioned, Dr. Reed, that, and I'm sure I don't have the numbers exactly right, that the impact of COVID at some point at the end of your graph that you had up was 7.9 for Black people, 7.4 for Hispanic people, 5.6 for white people, and then 9.1 for other. And then at some point, another slide indicated that the rate of death increased just recently for whites over Blacks. And I was just wondering, do we have a correlation of understanding why that happens before we could start getting to the questions from the from our participants?
Right. So some of those data, while it looks good on paper, but the statistics are only as good as the data collection goes. So if the data aren't collected accurately and we don't have data that show race, then our statistics are at best an underrepresentation of what the true story is for COVID, whether it's for COVID rates or COVID vaccines. So we have a significant number of people in the state of Florida, frankly, and including Pinellas, although Pinellas has done a slightly better job, but it's starting to tick up again. We have a significant population for whom we don't know race. So race is recorded as unknown on those people's COVID tests and their COVID record. So if we don't know their race, we can't adequately categorize them, and therefore we can't correctly calculate the statistics or the rate of COVID infection for those groups by race.
I have one other question too. We have been working at the Institute with a number of nonprofits in the area to just talk about the impact on the nonprofits in servicing the community. And from our lens, although they are tapped right now, to be quite frank, they are able to handle it. And the thing that they see the most are evictions and abuse. Do you believe that our county has the resources it needs to deal with the fallout from what could be evictions, or, as Tim indicated, issues with criminal justice, along with health disparities as we move towards trying to get to having us 100% vaccinated? The still impact that we do, because everyone is saying, oh, we're going back to normal and things are getting better. But there's still a significant number of people who are going to have the economic impact that is going to make them more vulnerable. And I wondered if you think the county is capable of handling that.
So I think there was a deep need for services even before the pandemic hit. I worked for several years with Pinellas County in human services, so I saw the need that existed and the dollars that were spent in that area. Thankfully, there are so many dollars coming in from the federal government to help alleviate the pressure on the counties to service the people. But I think that it's going to take a while to recover. And I think there's going to be, a significant investment in the recovery phase. We're still in the midst of COVID. We still have people contracting COVID. And so now there's the effort to vaccinate, but thankfully there are dollars coming in from the federal government that can help in that front. I think another area though that, as Tim has pointed out, is the housing issue. So if, we have all of these people who are dealing with possible evictions and potentially we're already on the cusp of having evictions, but I think you also have a greater population who probably had never been in this place before because the bottom has fallen out for a lot of them. And so there have been provisions in place from the federal government sending money to counties to help people who are in positions that they can't afford to pay their bills. But it's going to take a long time recovery if there are caps that are on the dollars that are available to these individuals, and there are. And then if they don't recover their jobs, as we see in the hospitality industry, a 53% drop in the numbers of people who are employed in those industries. If those aren't recovered, then this is a long-term recovery issue. And so, time will tell whether the monies are there to help people long-term. Tim, do you have anything to add to that?
I'll be quick because I know that we're looking forward to getting the questions from the audience. But it's really wonderful that there are federal dollars right now. this is so unusual when there's a problem that there actually are substantial federal dollars available, and they're $26 billion nationally, and it ends up being about 29 billion in Pinellas County between St. Pete and Pinellas County. It's related to specifically to eviction mitigation. So that's right now. That's after this past year of additional federal dollars on this. So we're fortunate, but as Stephanie says, this is a long-term recovery process, and you know, time will tell whether or not those federal dollars continue long enough to create the bounce back that's necessary to really give any sense of confidence in terms of families who don't have much money.
Thank you. We have some questions, and some I think you have touched on, but so I want to try to get to some of the different questions. Can either one of you explain the vaccine distribution model in Florida?
I can explain at a very high level. I'm not involved with that vaccine distribution locally, but I know that there are prioritizations of populations, and those are in some ways akin to the guidelines that are put out by the CDC and the association that gives advice on how to immunize populations. But we've deviated a little bit from those recommendations so that we're prioritizing the 65 and over age population, and that was initially in the recommendations a later priority group. I know that now there's a little bit of an expansion in dollars or vaccines sent to hospitals and to practitioners for people that are under 65 that have pre-existing health conditions or health conditions that put them at greater risk if they contract COVID. That's about all I'm willing to say, because I'm not.
I completely understand. You get that question all the time. I've run into a lot of people who have either they're taking care of someone with a vulnerable disability, or they have some type of vulnerable issue themselves and they don't meet the criteria. And it was wonderful that you said we were almost or near done with vaccinating our population for 65 and older. And it also is wonderful that we are being very responsible in talking about the history of vaccines and why people had some trepidation about taking them. Mm-hmm. Another question comes from one of our students. Are there talks of policies being put in place to combat this issue? I assume she means evictions, because that's when the question popped up. So if you can talk about any policies. I know to answer from the attorney perspective, I know there are many legal organizations that are working tirelessly to help support the influx of what they anticipated, many evictions. There are many types of free legal resources in our community specifically to address this. And everyone has been put on alert because we knew that this issue as a community would be longstanding for a while. So I do think that at least some of the legal organizations are prepared to assist with that. Tim, do you want to add to that?
Yeah, it's really a relevant question to the COVID phenomenon. So the beauty of the federal dollars is that they have made it so that as you're saying, Kimberly, Bay Area Legal, Gulf Coast Legal, Community Law Program, others have responded in a way to try to make sure that people don't get evicted. I mean, to be honest with you, this is that connection between eviction and homelessness, and it's really significant. So it's so important that we not only deal with this during COVID, but I think the nature of the question is what kind of policies can be developed long term, because before COVID, in Pinellas County, every day of the year, 11 families were evicted from their house every day. In St. Pete, every day before COVID, 4 families were evicted. And every day in the state of Florida, just about 200 families are evicted. So these are serious issues, and state policy change. Florida doesn't have a eviction policy that's very friendly to tenants. So it's important for us outside of COVID to make sure that the policies minimize the social cost, the family cost, the physical cost of being evicted. COVID just exacerbates the problem and the size of the problem, or at least its potential size. So I think there are solutions, and we have, there's a couple of them that we're working on. One has to do with a mediation program. The other one has to do with sealing records, but it gets very technical very quickly.
Those numbers are outstanding. We did a program with veterans, a couple of programs. We work with Congressman Gus Bilirakis, who is strongly associated with veterans, and we did a resource fair where they talked about evictions being a huge issue. I don't know if your research, either one of you, impacts veterans as well, but do we have any separate data on how COVID is impacting our veterans in the area?
No, the data I use are specifically from the Department of Health, and the data aren't tracked in that way. So I don't have specific data on veterans.
Well, as we get to the end of our program, I would really like you to just expand, because of course, it's very early today. So we have some students logging on a little bit late, and I'm looking at some of the questions that it looks like you did touch on earlier, but I would like you, as you wrap up, to address again that why slide. I think that you put up was most important to understanding how you translate data to impact. And I think it's important for people to really understand when we're talking about combating COVID as a health issue, but also as an economic issue. So at the outset of this, that we are a stronger community, putting those ties together is important. So as you both wrap up your comments today, if you would kindly reiterate how data is important to understanding the impact, which is important to understanding why we push for certain policies to alleviate those economic challenges in the county that impact all of us as a whole.
Sure. So this is
a mouthful, right?
It is. So as I mentioned, these disparities that I shared that are specific to COVID and are specific to the impacts of COVID and COVID cases and in COVID impacts in the economic sector and the labor markets. These are just exacerbated by this COVID pandemic. But these disparities that we've seen in health outcomes in general, and in preterm birth, and in education statistics, and in employment statistics, were there before the COVID pandemic hit. COVID has served to exacerbate those and to really highlight and shine a light on the fact that these disparities exist in a way that I don't think we've seen outside of public health in some select sectors ever. These data on disparities have been collected since probably for over 40 years now. So the data have been there, but the willingness to act on them and the willingness to do something about it and to understand the root causes of it have not always been there outside of public health. So if there's any, thing positive to come out of COVID, then that would be one thing I would say. That now there's definitely more people willing to look at that, more people acknowledging the disparities, and it presents a great opportunity to then say, so now what do we do? To have these conversations, to call the reasons out for what they are, to understand the deep history of racism and how racism has impacted us in so many ways in this country. It's interesting to when you think about racism, people think about the ones that are on the receiving ends of racism, but we're not the best society we can be unless everyone has the best opportunity they can have to succeed in life. We as a society can be so much better if everyone had the opportunities that they deserve to succeed. So when we think about the data, it's definitely something we want to continue to track. But now I think, given the opportunity that we have now with how COVID has shined a light on this, now is also the opportunity to act and to say, what policies can we put in place? What policies do we need to change so that we don't continue to see these types of disparities going forward.
And Tim, final thoughts?
Sure. Let me parallel that conversation. Over the past 10 or 15 years, Yale did 2 studies about to what degree is race equity considered to still be an issue. And they said, yeah, not so much. We think that was pretty much handled in the 60s with the Civil Rights Act. So that is really Stephanie's point. The experience with COVID has elevated these issues to a much higher level, and there's a window for conversation that really can make a big difference now that the issues of racial disparities are so much more visible around the COVID phenomenon and everything that happened in 2020. The last thing I'll say is that when Stephanie talks about the fact that when everybody's gifts or everybody's capacities are brought to bear in just using economic terms in the economy, and they aren't now because of issues that have to do with structural and systemic racism. The calculation that we have in our equity profile is that this economy in Pinellas County would, if there were no inequities based upon race, the economy would be $3.6 billion bigger. So there's a tangibility to this that plays itself out. It's an opportunity we have to really make a big difference.
I'd like to thank both of you all for joining us, and again, thank Dr. Brown for connecting with us to have this program so that we can enlighten our Alumni Association and to just spread context and give information. As in my prior role as the department chair for political science, Charlie Justice would always come to the classroom. And he was always great. He's chock full of information, but he would talk about, very passionate about the 5 pockets of poverty in the county and how they have shaped the county and how they continue to impact us. And it's very interesting, the conversations, being a resident here and now being not just of St. Pete, but now from St. Pete, to see how we have evolved on some issues, and then to see countywide how we have evolved on some issues. So I'd like to just, take the time to say right now that it's wonderful to be in this role, to have wonderful, expansive conversations that, as our tagline says, enhance, educates, and engages the community in thought-provoking issues so that we can all do our share to be better citizens and to explore all sides of the issues. So we invite you to come back to ISPS at any time. Again, if you'd like to learn more about what we do, please go to isps.spcollege.edu or visit our website. And with that, I'd like to promote our upcoming programs. So again, COVID has sort of shaped our lens. And so we received many ideas about how to address them. One of them was on guardianship. And because unfortunately people are losing loved ones, or they're thinking about planning or in estate planning and how they interact with people who are incapacitated. We're doing our 2nd series on guardianship, and that will be on Friday, March 19th. Next slide. I don't know how many people follow this, but Oldsmar was hacked. And because it was hacked, it was a huge issue on what happens when a system is hacked and how it impacts our community and why we were targeted and what that means for the country in terms of attacking municipalities or counties and their systems. So we're going to explore that and talk about why it matters from a social aspect and, more importantly, an economic impact. Next slide. We always partner with different entities. We partnered with the St. Petersburg Chamber of Commerce for this one, but next time we're partnering with the Seminole Chamber of Commerce, and they're going to do a regional economic outlook for 2021 with Jerry Parrish, who's with the Florida Chamber of Commerce. And I think we have one more slide. And that's it. Well, I'd like to say that after that, we will do our 2nd series on COVID with Dr. Coe and talk about a longer lens of from the Florida Department of Health's perspective. Again, thank you so much for joining us today. Please continue to spread the word about what we do and why it's important. And we look forward to seeing you at our next program.